All too often in our systems of care, we wait for people to be in crisis. We wait until the police service or the emergency department is the front door to mental health care.
You may have noticed yourself monitoring your health more often this year, checking for COVID-19 symptoms. But have you been monitoring your mental health? This week is Mental Illness Awareness Week, an annual campaign that, for the very first time, is happening during a global pandemic. And with darker, shorter days of fall and winter ahead of us, health officials want you to check in with yourself and loved ones.
Work research that we've done actually recently with UBC has absolutely shown that the pandemic has actually had a really big impact upon the mental health of British Columbians.
Part of the challenges that we face is that this is an underfunded area historically. So when something like the current pandemic happens, we see the impact maybe heavier in this area because of the past situation.
Ahead of BC's provincial election, the Canadian Mental Health Association is asking party leaders to commit to more funding for mental health care.
The mental health system, and arguably the substance use care system, is one of the only systems of care that actually sometimes says no, sometimes refuses care. And we hear at CMHA of cases with frequency of people who knock on the door of the system, they're told it's the wrong door, or the door doesn't open. We've heard from people who've been told that they're not sick enough, that they're not unwell enough to access care. And we're actually calling for a $2 billion investment over 4 years. That's what we think is required to really start to build a system that's in need of some repair.
Supports and resources are available on the Canadian Mental Health Association's website, and anyone in crisis can call 310-6789. In Vancouver, Isabel Regem, City News.